In this video, we see the anatomy of kidneys. We see the functions, location, external anatomy, internal anatomy, blood and nerve supply to kidney, nephron, and histology of nephron. This is the urinary system diagram. It is the main excretory system. It consists the kidneys to ureter, bladder, and the urethra. The kidney which secrete the urine, then this ureter convey this urine from this kidney to the urinary bladder. Then urinary bladder is collect the urine and it temporarily store. Then urethra, through which the urine is passes from this bladder to the exterior. Now we see the term nephrology. Nephron means kidney and the logy means the study of. It is the scientific study of anatomy, physiology and pathology of the kidney. Now we see the functions of kidneys. First, the regulation of the blood ionic composition. The kidney is regulate the several ion composition like sodium, potassium, calcium, chloride, etc. Then regulation of the blood pH. The kidney excrete the hydrogen ion and conserve the bicarbonate ion, which is the important to buffer up the hydrogen in the blood. Then regulation of the blood volume. The kidney is conserving or eliminating the water in the urine, so it regulates the blood volume. Then the regulation of the blood pressure. The kidneys secrete the enzyme that is called the renin. The renin is activate the renin angiotensin aldosterone system. If the renin is increased, that is also increasing the blood pressure. Then the maintenance of the blood osmolarity. The kidney is regulate the loss of the water and loss of the solute also, so it maintain the osmolarity. Then the production of hormone. Kidneys produce a two hormone. First is the calcitrol and second is the erythropoietin. Calcitrol is the active form of the vitamin D, help to regulate calcium homeostasis, and the erythropoietin which stimulate the production of the RBCs. Then regulation of the blood glucose level. Like a liver, kidney is also secrete the glucose in the blood and it maintain the glucose level. Excretion of the waste and the foreign substance. The kidney is excrete the waste product like a metabolic product, bilirubin, creatinine, ammonia, urea, uric acid. It also excrete some drug and environmental toxin also. Now we see the locations of kidney. It is the posterior of the abdominal wall, one on each side of the vertebral column, then below the diaphragm. It is from the 12th thoracic vertebra to the 3rd lumbar vertebra. Then it receives some protection from the lower rib cage. Then the right kidney is slightly lower than the left kidney because the liver is located on the right side. Now we see the external anatomy of kidney. Kidney is the bean-shaped organ. The size is about 10 to 12 cm long, 5 to 7 cm wide and 3 cm thick. It is about the soap of bark. Then the weight of the kidney is about 130 to 150 gram. There are the three tissues surrounding the kidney. First is the renal capsule, then adipose capsule, then renal fascia. Adipose capsule and renal fascia is the tissue which is hold the kidney in their position and it protect the kidney from the trauma. And this renal capsule is the upper layer of the kidney. Then renal hilum. This is the renal hilum which allow the entry of the blood vessel or lymph vessel nerve in the kidney. There is one term Nephrotosis means the floating of kidney. It is meaning the displacement or dropping of the kidney. It is developed most commonly in very thin people whose adipose capsule and renal fascia is deficient. We see the renal adipose capsule and the renal fascia is hold the kidney on their position. It is very common about the 1 in 4 people has some the degree of the weakening of the fibrous band that hold the kidney in the place. Then it is more common in female than male. Now we see the internal anatomy of kidney. There are the two areas of the tissue in the kidney. First is the renal cortex and second is the renal medulla. This renal cortex is the reddish brown layer of the tissue. It immediately below the capsule and outside of the renal pyramid. Then this medulla is the innermost layer, consists a pale conical shape called a pyramid. These are the pyramid. Then renal papilla. It is at the apex of the renal pyramid. Then these are the minor calyx. Then this reunite the minor calyx, it form the major calyx, and the union of the major calyx is form the renal pelvis. Renal pelvis is the funnel shaped structure. Then this is the renal vein and renal arteries. Kidneys compose about 1 to 2 million nephron and the collecting duct. In each kidney, minor calyx are 8 to 18 in number and 2 to 3 major calyx. Now we see the path of urine flow. The urine is formed in the nephron here. Then it carry from this nephron to the minor calyx by the collecting duct and the papillary duct. After it come in the minor calyx, then it flow to the major calyx, then renal pelvis, ureter, and finally in the urinary bladder. Now we see the blood and nerve supply of the kidney. Here, kidney receive the 20 to 25% of the resting cardiac output via renal artery. Then the blood flow through the both kidney about 1 to 2 liter per minute. Within the kidney, the renal artery is divided into the segmental artery, and this segmental artery is divided and form the interlobular artery. Interlobular artery, which is between these two pyramid. Then this interlobular artery is formed the arc between the renal medulla and cortex, and it known as the arcuate arteries. Here, then arcuate artery is divided and form the interlobular arteries. Then the branches of the interlobular artery is called the afferent arteriole. The afferent arteriole is entered in the nephron and form the capillary-like network. It's called a glomerulus. Then this glomerulus capillary then reunite and form the efferent arteriole. This efferent arteriole is divided and form a peritubular capillary which is surrounding the tubular part of the nephron. Then peritubular capillary is reunite and form a peritubular venule, and then interlobar vein. Then the blood is drained through the arcuate vein to the interlobar vein running between the renal pyramid. Then the blood leave the kidney through the single renal vein. This is all about a blood supply of the kidney. Then we see the nerve supply. The renal nerve are the part of the sympathetic division of the ANS system. most of the vasomotor nerve that regulate the flow of the blood through the kidney by causing the vasodilation or the vasoconstriction of the renal arteriole. Now we see the nephron. This is the diagram of nephron. Nephron are the functional unit of kidneys. Each kidney consists of the two parts. First is the renal capsule and then a renal tubule. This is the renal capsule and all part is called the renal tubule. The renal capsule is contain the glomerulus and glomerular capsule. We see the glomerulus, it is the capillary network of the arteries. Then glomerular capsule, this here the filtration is occur. Then the renal tubular is contain the three part. First is the proximal tubule, then this here pin U shaped structure is called the loop of Henle, then the distal cannulated tubule. The cannulated meaning the coil structure. The proximal and distal is the coiling structure. Then nephron are the two type. First is the cortical nephron and second is the juxtamedullary nephron. This is the diagram of the cortical nephron. In this nephron, the loop of Henle is in the short and the juxtamedullary nephron here it is the long the loop of Henle, and the other difference is the ascending limb. This is only one ascending limb, and here in the juxtamedullary nephron here is the thin ascending limb and the thick ascending limb. The loop of Henle is divided in the two parts, descending limb and the ascending limb. Here is the about of the nephron. Now we see the histology of nephron. The proximal cannulated tubule is contain the epithelial cell with the prominent brush border. This is the prominent brush border and it allow the secretion and reabsorption. Then the loop of Henle, in this the descending limb and the thin ascending limb, it consists of the simple squamous epithelial cell. Then the loop of Henle, the thick ascending limb is contain a simple cuboidal to a low columnar epithelial cell. Then the distal cannulated tubule is contain the simple cuboidal epithelial cell, and the last part of the distal cannulated tubule and the collecting duct is contain the simple cuboidal epithelial cell. Now this is all about the anatomy of kidney.